Hi everyone! We are Katie Walker, Jacqueline Lamb, and Elsa Sahachu, and we are Team 6. Today we are going to be talking about the current state of hospital accreditation, licensure, and certification. Each of these criteria are not only essential in maintaining quality care in the healthcare environment, but also keeping up organization in today's hospitals. We will touch on what these requirements are, how to obtain them, and their effect on the future of healthcare.
Accreditation means that the organization, agency, or program was able to demonstrate evidence of implementation to all of the relevant standards. If an organization is accredited, this means they conducted a thorough self-assessment and compared themselves to recognized standards of best practice. It is a rigorous process conducted by a third-party organization. The accreditation process typically repeats every 2 to 4 years, depending on the accrediting body.
Licensing exists primarily for public safety and the well-being of consumers. Organizations are required to follow physical compliance codes to open their hospitals, such as building and sanitation codes. This allows hospitals to provide specific services such as residential treatment or substance use disorder services. Furthermore, practitioners and programs are required to be licensed or they will face penalties including being suspended or closing off the agency.
Certification confirms that an organization meets a minimum set of predetermined and standardized criteria to perform a specific function. For example, this may include reimbursement for Medicare and Medicaid. Certification may also enable the entity to provide a specialized service.
Accreditation is conducted by the Joint Commission organization. The Joint Commission undergoes an evaluation process that can help healthcare organizations assess, measure, and improve performance. Their standards set expectations for organization performance that are reasonable, achievable, and surveyable. 4,477 hospitals, or about 88% of accredited U.S. hospitals, use the Joint Commission. It is one of the more expensive accrediting organizations with annual fees that can run into tens of thousands of dollars with additional costs of surveys. Yet the direct fees are only a small portion of the investment required. Staff time, consultation services, and other aspects of preparing for the surveys can rack up large indirect costs. A survey is designed to be individualized to each organization, to be consistent, and to support the organization's efforts to improve performance. During the on-site survey, Joint Commission surveyors evaluate an organization's performance of functions and processes aimed at continuously improving patient outcomes. They do this by tracing the care delivered to patients, residents, or individuals served, reviewing information and documentation provided by the organization, and observing and interviewing staff and patients. Overall, their efforts aim toward important care and organization functions that are essential to providing safe, high-quality care.
A license issued by the Agency for Healthcare Administration is required in order to operate a hospital. It is unlawful for a person to use or advertise to the public any facility as a hospital unless the facility has first secured a license. However, this licensure does not apply to vet hospitals or to commercial business establishments using the word hospital as part of a trade name, if no treatment of human beings is performed on the premises of such establishments. In order to apply for a license, a hospital applicant must have a current project under review with the agency's Office of Plans and Construction. Applicants need to submit a hospital licensure application, fees, and supporting documents 60 to 120 days before the anticipated effective date. When all required information is received and acceptable, an initial licensure inspection will be scheduled. Licenses will be issued when documentation of a successful licensure inspection is complete and filed. Please note that a valid license is required before any patient care can be provided. A separate application is required for each facility located on separate premises.
Certification demonstrates the capability to provide a specialized service or particular program. Typically, certification is voluntary, but sometimes regulatory bodies require certification in order to provide a specific service. Certification is similar to accreditation in that facilities, programs, organizations, and agencies can all obtain it. However, an individual is also able to earn a certification. This is because certifications are often provided by a professional organization, such as a university. So does certification ensure high-quality care? Well, it seems that policymakers think so. The Centers for Medicare Services, or CMS, require that hospitals either be certified or pass a state inspection to receive Medicare reimbursement. If pursuing certification, hospitals may choose to work with one of several accrediting bodies to whom they pay a fee to undergo the survey process. Alternatively, state inspection involves an evaluation from a state survey agency on behalf of the CMS. Although an inspection may sound appealing to hospitals if they want to avoid the high costs and administrative burdens associated with certification, the vast majority of acute care hospitals opt to become certified.
Based on the limited amount of data and more recent evidence, should we give up on accreditation, licensing, and certification? Absolutely not. These criteria remain a cornerstone for ensuring at least a basic level of quality, at least for things that the healthcare system assesses. Patients want to know that a hospital provides safe and effective care, and these factors can be a powerful tool to offer that assurance. The problem, it seems, is that accrediting organizations is not focused on what actually matters to patients. The criticism that these organizations spend enormous amounts of energy requiring hospitals to focus on things like signs in the hallway or how documentation is done appears to have some merit. We need to re-examine the standards required for accreditation, certification, and licensing to ensure that they are promoting what's actually important: the health, safety, and optimal experience of patients.
This raises some questions about the process. First, how would you improve the current process of hospitals getting licensed, certified, and accredited? Also, what would happen if these processes and these licenses, certifications, and accreditations were not required in hospitals?